Good afternoon. We'll now start our pep talk. First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture, sign in your name, Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your face in the video. Another reminder, please take the online learning Kung evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. We have placed the link in the chat box. Another reminder, obtaining 50 OLETE certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation like the one shown here. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. So please turn on your video and show your face. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled Generics Awareness, Law, and Medicine. This is in consonance with the Department of Health Awareness Calendar, in which on the month of September, we celebrate or we observe the so-called Generics Awareness Month. The empowerment objective in this pep talk is for the lay people to have an essential understanding of generics, law, and medicine in their health management. The contents of this pep talk will be the following. What is the meaning of generic in non-business contexts? In business contexts, what are the generic versus branded goods? What are generic name versus branded name drugs? What are the differences and similarities? How are drugs named? What is the Generics Awareness Month? What is the generic law in the Philippines? What is the current state of implementation of the Philippine Generics Law? And what are ROJoson advice on the use of generic medicines? I'd like to have a disclaimer. This ROJoson pep talk contains my thoughts, perceptions, opinions, and recommendations, or what I call TPORs, culled from personal experience as well as from the experience of other professionals. Let's start with the first topic. What is the meaning of generic? Generic in the non-business context means characteristics of or relating to a whole class or group. Examples, when you say tissue, tissue is a generic word for any soft, thin piece of paper that's good for wiping something like runny noses. Another example, when you say social media, it is a generic phrase for Facebook, Twitter, Instagram, etc. Generic, on the other hand, in a business context refers to products companies market without a trademark, brand name, or other distinguishing features. Examples: generic versus branded goods or products. Generic products are those that we name only by their basic product type. In other words, we do not name them by their individual brand. Example, we can call them sodas or colas, and so these are the generic goods. Or if we want to refer to the branded goods, we call them by specific name like Coca-Cola and Pepsi-Cola. Trademark means there's an easily recognizable and unique symbol, phrase, or word that denotes a specific product or used to represent a business enterprise and its products. Nowadays, all generic goods have a brand name to identify the manufacturers. As we know, there is now a very popular company called No Brand, but this company sells all kinds of generic products. So what is the meaning of generic drugs? What is the main difference between generic name and brand name drugs? For generic drugs, there is a special definition compared to generic goods. So generic name versus brand name drugs. Brand name drugs are the so-called pioneer or innovator drugs sold by a drug company under a specific name or a brand or trademark that are protected or that have been protected by a patent. Whereas generic name drugs have the same active ingredients as the brand name drugs, the pioneer or the innovator drug, but are sold only after the patent or the patent of the brand name drugs have expired. So drug patents, for your information, for the pioneer and innovator drugs are usually good for 20 years after the drug's invention. However, only about 10 years are the manufacturers allowed to exclusively market the drugs after they have been approved for human use. The drug patents protect the inventors because of the huge expenses entailed in developing the drugs, in testing the drugs for human use. So this is a reason for the higher cost of the innovator drugs or the branded name drugs or the pioneer drugs. Note, but nowadays, every drug has a brand name and a generic name. All generic name drugs and all brand name drugs contain a generic name and a brand name. So how do we differentiate the two? I will discuss this later on. Generic drugs are pharmaceutical drugs that are equivalent to a brand name medication in strength and dosage. They are also the same in quality, performance, intended use, and route of administration. Generics possibly contrast with brand name medications in terms of taste, packaging, and color. However, they are identical in every other sense. So as soon as the patent of the brand name drugs expires, other companies can now compete selling generic versions. Therefore, a generic drug is a drug that competes with a brand name drug after the patent of the brand name drug expires. So in summary, for the differentiation of the generic name drugs, brand name drugs, and innovator and pioneer drugs, generic drugs are those drugs not covered by patent protection and which are labeled by their international proprietary or generic name. Whereas pioneer or innovator drugs are drugs initially with patent protection. When you say brand names, so this referred to the proprietary names given by the manufacturers to distinguish their products from their competitors. So all drugs nowadays have a generic name and a brand name. And nowadays, it is also difficult to distinguish pioneer drugs except for the price, which is usually higher for pioneer drugs. Brand name drugs or innovator drug of paracetamol is Panadol before the patent expired. After the patent expired, Tempra, Biogesic, and other generic drugs with different brand names came out. So these are the generic drugs, paracetamol, with brand names competing with Panadol, which also carries a brand name, Panadol. How are drugs named? Drugs often have several names. When a drug is first discovered, it is given a chemical name which describes the anatomic and molecular structure of the drug. The chemical name is usually too complex, too complicated, too cumbersome for general use. So usually a shorthand version of the chemical name is used. The chemical name is also the generic or official name of the drug. If the chemical name is short, then it is used as is, as the generic name. If long, the shorthand version is used for the generic name. Thereafter, a manufacturer places a brand name or the so-called proprietary, trademark, or trade name. For examples, paracetamol is the chemical or generic name, and Panadol, which is the pioneer drug, and Biogesic and Tempra are the generic medicines, are the brand name of the same drug. Another example, tamoxifen is the chemical or generic name, and Nolvadex, which is the pioneer drug, and Tamoxen and other generic drugs like Gyroxen are the brand names for the same drug. Phenytoin is the chemical or generic name, and Dilantin is the brand name for the same drug, which is commonly used for anti-seizure drug or epilepsy. What is the Generics Awareness Month? The month of September is known as the Generics Awareness Month. This celebration aims to spread awareness among Filipino people about generic drugs that are effective, yet safe and low cost. The said celebration also aims to promote and ensure the distribution, use, and acceptance of drugs and medicines identified by their generic names. What is the Philippine Generics Law? It is known as Generics Act of 1988 or Republic Act number 6675. It is an act to promote, require, and ensure the production of an adequate supply, distribution, use, and acceptance of drugs and medicines identified by their generic names. This act is passed or promulgated for the benefit of all Filipinos, especially the underprivileged ones, to provide them with lower cost drugs. There is another law to support the Generic Acts of 1988. This is the Cheaper Medicine Act of 2008, also known as Universally Accessible, Cheaper, and Quality Medicine Act of 2008, which amended parts of the Generic Acts and now require pharmaceutical companies to produce, distribute, and make widely available generic drugs. Again, these are for the benefit of all Filipinos, especially the underprivileged ones, to provide them with lower cost drugs. What is the current state of implementation of the Philippine Generics Law? The Generics Act of 1988 and the Cheaper Medicine Act of 2008 aim to help the Filipino people with their medication needs. 35 years from 1988 up to now, and 15 years from 2008 up to now have passed, and the Filipino people have not taken full advantage of the benefits intended for them. So where, what is, are the root cause or causes of this problem? Is it coming from the government, drug manufacturers, retailers, physicians, consumers, or patients? I will not dwell on the causes, but rather give advice to the lay people as part of my patient empowerment on how to maximize the benefits given them by the laws of generics. My first advice consists of the following. Generic drugs are as effective and safe as the innovator or pioneer drugs. Generic drugs are of lower cost compared to the pioneer drugs. There is a marked difference in prices between pioneer and generic drugs. So use the generic drugs. Use the generic drugs rather than the innovator drugs if the former is available. If given a prescription by a physician, always ask the physician, how much do the prescribed medicine cost? How much are the medicine that the physician prescribed will cost? Ask whether the prescribed drug is a pioneer or generic drug. Ask a follow-up questions on whether there are other medicines or other brands with the same active ingredients that he or she would recommend that are of lower cost. If the physician practices patient-centered and compassionate care, then he or she should be able to give advice on the above questions. So try to ask questions. When buying medicine in any drugstore, if the physician does not insist on a particular brand, always ask the pharmacist if there are generic drugs with the same active ingredients or the same chemical name. Ask him or her which ones are pioneer drugs and which are generic drugs, and inquire on the comparative cost or prices. Ask a follow-up questions on whether there are other brands with the same active ingredients or chemical name that are of lower cost. If the pharmacist practices patient-centered and compassionate care, she should be able to give advice on the above questions. So always ask the pharmacist and the earlier advise the doctors. So this is a myth. Pioneer drugs are more effective and of higher quality than generic drugs because they are more expensive. So this is false. So what is true is that all pioneer and generic drug contains the same active ingredients. So they must be equally effective and safe. And all generic drugs are effective and safe as long as they are approved by the Food and Drug Administration. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on generics law and generic medicines. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on generics law and generic medicines in your health management. So these are the contents that I have discussed earlier. I won't repeat them anymore. Just take a quick look. So this ends my pep talk for today. I hope I have empowered you, the lay people, to have an essential understanding of generics, law, and medicine in your health management. Before we go to the question and answer portion, reminder again, take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. Recipients of 50 or obtaining 50 or latest certificates will entitle one mentee to a voucher for an ROJoson telemedical consultation. Feedback to this pep talk. I'd like to request that please type in your feedback in the chat box during the open forum and before we adjourn. And then, so let's now start. Let's have a group picture taking before we start the question and answer portion and interaction. Please turn on your video now and show your face.